As far as why I wanted to go into medicine, it's something that was part of me from as long as I remember. I always enjoyed the idea of being able to help people and to do things for them in a medical way. And I realized that in dermatology, I could have a lot of things that were really, to me, fun about medicine. I could have a good relationship with the patients. Those patients could be 3 months old, they could be 3 days old, they could be 30 years old, or they could be 95 years old. So you get to see all kinds of different kinds of patients. I had this interesting level of expertise in the skin where you can walk into a room and look at a patient, talk to them, and have a diagnosis and make a big difference in their lives in a 5 or 10 minute period, which may have been a problem that they've been pursuing in other areas for months, and they just haven't been to the right person to help provide them the knowledge they need to get better. So that was appealing to know that I could acquire that knowledge and help people. I always enjoyed learning more about the different surgical techniques that I could bring to bear to repair someone's defect after we do most surgery in a way that they can come back to me and say, Doc, it looks great. My friends and family can't even tell where I had it. That kind of stuff is fun when you've worked hard and you've brought that to the patient through your hard work. My approach to medicine is to, and as it always should be, is to make that revolve around the patient. When I come in the room and I start asking questions about what this is or introduce myself, the first thing that I'm going to do is I'm going to find out in the patient's own words why they're here, what's going on, and why is this thing bothering them. Because if we take that time to put the patient right in the middle, and I know it sounds kind of funny to do to some people, of course you do that, but sometimes a physician is putting the disease in the middle, or what he thinks he needs to find, or he's already to the next step trying to figure it out. And what we really need to do is to find out what's going on with that patient, because then that leads us everywhere that we need to go. That's one of my big practice philosophies, is to take that time to listen to what's going on, because it's then going to be able to help you come up with the correct way to help this person.